Hi, everybody. Thank you so much for tuning in to this webcast with Dr. Hussain. We had to bring him back because we had such wonderful feedback. He's an amazing ambassador for our industry. And we wanted to talk today about probably four main subjects: dispelling some myths, perhaps that fitness professionals have of GPs and the NHS, and vice versa, what perhaps our GPs and NHS think of the fitness industry, and then how can we build those sort of bridges between us. I want to reference the first webcast Dr. Hussain did because it does talk about how you can develop that. But also what we're going to do is dig deep into, medical clearance, people with long-term conditions almost feeling like they can't get on with exercise, and there's some exciting news and initiatives that Dr. Hussain is going to talk to us about. So Dr. Hussain, thank you for joining us from your clinic. You are very welcome again.
No, thank you for having me. It's exciting to jump back on.
Absolutely. So shall we hit that first question? So what do you think are the myths that perhaps the fitness industry have about GPs and what the NHS is doing right now? Big question.
Yes, big question. And I've had a meeting, in fact, on Friday with the SIMSPA. So I have some very recent kind of information as to kind of what they feel have been some of the barriers and some of the issues and vice versa. Now, I definitely feel that there is a huge variety within primary care, as there is within any kind of membership. So you'll have some GPs that are really passionate, knowledgeable, and approachable for the physical activity sector, but you will have a big chunk that either aren't engaged with physical activity on a professional or personal level, or the majority, in fact, are just completely sort of swamped with day-to-day work that they haven't been encouraged at any point, whether that be in their training, medical school, or in practice, to consider things like physical activity. They just focused on what we call the medical model and the traditional method, which I think is a shame. However, there is a growing movement amongst healthcare workers and GPs included to embed lifestyle much more into the core work, because we know it has profound benefits, far more impactful than any drug or surgical intervention for the vast majority of people. And so you're seeing this growing interest. Now, I know that for many in the physical activity sector, it's going to be a small proportion at this stage, so it can be frustrating when you're trying to engage with healthcare professionals, but change is coming, truly is. We're seeing greater membership amongst the British Society of Lifestyle Medicine. We're seeing greater investment into training for lifestyle medicine. So Red Whale, one of the big NHS deliverers for teaching, is for this year going to be starting a lifestyle course. So this is where we're going to embed and give healthcare professionals confidence around things like physical activity. So therefore they can look to embed it into the practice. And that will involve, of course, reaching out and connecting with the physical activity sector in their area. So the hope is that as part of the training, they're going to be given those tools as to how do you go about working with someone in the physical activity sector and trying to remove a number of the barriers. So therefore, there isn't reasons why that doesn't work out.
Yeah, because there are barriers, but the word that sprung out to me is about confidence, isn't it? It's like, it's if there's a small amount of training done, well, and perhaps that person isn't sort of using physical activity themselves. Maybe they don't feel informed enough of how to do it. So I totally get it. So with regards to sort of dispelling those myths and stuff, do you think that fitness instructors, professionals sometimes make a sweeping judgment that GPs are just into that medical model and that they don't understand fitness instructors? Do you feel that can sometimes happen in the fitness industry, or what do you
Yeah,
think?
I think so. But I think it's in many cases quite valid. So I think it's come from a genuine place. And And I've heard countless stories when I've spoken to various different people in the physical activity sector. My heart always sinks because, it's painful when they're trying to do what they can to support the community's health, and they are approaching places where you'd think these are natural bedfellows, and they're not getting the response that they need. I can see how demotivating that is, and it's frustrating. But, as I said before, change is afoot, and I'm seeing more and more places that are. And, as I touched on previously in our past podcast, look to seek those areas where there is those advocates. And there's two main places I would look. I would look, one, on the active practice map. So if you Google the Royal College of GPs active practice and then just type in map as well, it'll take you directly where you can see where the local place where they've sort of done a lot of work in around physical activity, because there will be staff members within those practices that are big advocates. So I'll definitely connect with them. And on each map, there's an email address for the contact for that practice. So you can try and engage that way. The second place is look on social media in your local area, because more and more now we're seeing GPs and other healthcare professionals like myself going onto social media to provide kind of like an advocacy role. We're really trying to push for more and more of this. And so we're going on social media to help educate, to help inspire, and to help, get more people involved with movement and physical activity. So have a look to see, which ones are local to your area, because they can either work with you or they can point you out towards people that they know in their network in your area to start that process.
Yeah, love that. Thank you for that recommendation again. And you obviously advocate physical activity, and you can see it on your social media and stuff. I know you're very involved, so they can follow you at Iron Dr Has. The link will be below, and I don't know why I say below, because it could be to the side. I don't know, but it will be around somewhere.
Be somewhere.
It will be somewhere. So okay, so we've looked at perhaps the barriers and stuff, which and you said sort of you understand the sort of frustrations that fitness professionals might have. What about the other way? So what is a potential that you see of GPs perhaps misunderstanding fitness professionals? Can you comment on that from your point of view?
Yes. Like I've been trying to find out more and more about this from other colleagues that I get different experiences, and we have done some surveys into this. And now, for some, there's a concern around the kind of the training that they have been given, not around physical activity, although that's another question. I think there's often confusion amongst healthcare professionals to when someone's coming and you're assessing to start a collaboration or relationship with someone within the sector of physical activity, what is good training? Because we know what it is in healthcare. We know the degrees that you need. We know the qualifications you need. Sometimes amongst certain professionals, there is that confusion as to, have they got good training? Is this just an online course that they've done for 4 hours? So we're trying to, and working with SIMSPA at the moment, to put information out on the college website, so therefore people can know, what are the accredited qualifications? What are the different levels? What would you expect from each level? Because at the moment, there isn't much awareness outside of those real advocates like myself, where we can try to decipher, what is good and bad. Because that can really be a stumbling block, because at the end of the day, it is the reputation of that healthcare center, trust, whatever. If we are going to be working alongside someone else, we need to know that they're going to be getting good advice, because now, in the majority of cases, I know that, physical activity professionals are really good at what they do. They know what their limitations are in terms of knowledge and giving out that advice, and they do fantastic work. But there are a few cases where, sometimes incorrect information is being given, and often they get the most awareness on social media. So when, clinicians are looking on their social media and they just see just the endless kind of nonsense that's on there, that's actually from a very small proportion of people within the physical activity sector. But because of the sort of often how the algorithm works, that nonsense gets amplified. And sometimes there's a concern amongst GPs, nurses, etc., that if I refer someone down this way or signpost them to this group, they may be getting some, unusual bits of advice that isn't always evidence-based.
I love the term unusual. That's a very diplomatic way of putting it. But I agree, I can only imagine from a GP's point of view, yes, you've got to be referring out to things that A, you can trust and is going to be wholesome and right
Yeah,
for
yeah, and bulletproof as well. Like, because the thing
bullet.
is, like, oh my God, the complaint that would come back if, let's say, you referred me to, let's say, Craig, and Craig told me about something unusual that we're going to put in, like it's the GP's, kind of responsibility and their reputation that's now been put on the line.
Absolutely. And so I get it. And I get it from the point of view of people in the fitness industry. We know that there are set standards, there are set qualifications, but we do know there are different ways of them being perhaps presented,
Delivered, yeah.
delivered is the word, and also perhaps how they're being received. So I get it. So now let's say the GP has found, knows what standards to work to, how they can select people. How do you think a fitness professional could stand out well as somebody that could work well? So we're talking about building bridges
Yeah.
and breaking down those barriers. How can I stand not to beat the competition down, but to
Yeah,
prove
yeah,
to
yeah.
you that you want to work with me? How do I do that?
So, like, it's the same way that we really forge good relationships. So if I think about the physical activity providers that we have engaged and integrated into our service, they're the ones that have gone above and beyond in developing that relationship. They meet up with us face to face. They invite us to their sessions. So me and my staff have done, not just one, but multiple sessions within their output, and so you get a feel for it. You get to also even give some tips and advice from your experience if they're going to be engaging those with, let's say, long-term health conditions or disabilities. We can give them some tips and ideas about how that they frame it, maybe some slight design tweaks, and that two-way sort of communication and relationship is what will get you those kind of long-term projects where you can be getting real access to patients that need to be active, and you can do kind of the thing that I guess you got into in the first place, which is encouraging people to get more active than they were before to benefit their health. So yeah, it's about developing those relationships. Don't be afraid to, for example, give some free tasters to the local primary care network or surgery. Get them down, get them, actually having a go with your sessions. They can get to see you doing what you do best, and they can also envisage what it will be like for the patient. Because then whenever, let's say I'm speaking to a patient and I'm trying to encourage them about Megabox Fitness, for example, that's one of the groups that we engage with, like I can genuinely tell them what it will entail. So when they ask me, oh, God, what's that like? I'm like, what? I can let you know. I've done it 3 or 4 times. And so that can be really impactful because the patient can tell. They can tell when you're signposting them something that you've just read on a leaflet or you've had an email about or just a meeting compared to something that you have done.
You've done it, absolutely. So Hussein, it strikes me that you must have so many hours in your day. How do you manage everything that you do and be able to still advocate for your patients in such a way? How do you do it? This has got to be from a true passion
Yeah.
to like really build the barriers between the two. I want to just dig into how do you do it? Where does it come from?
Yeah, no, for sure it's a juggling act. And that sort of passion to push and to, like, for example, I spent the whole weekend working just because like there was a lot of things that I wanted to try and tick off to make sure that we can get more patients able to access movement that they enjoy. And the reason is that, like, I may have, I don't know if I touched it in the previous podcast or not, but, like I have not been active all my life. I
No.
only found activity much later on in life, in sort of my mid to late 20s, after being diagnosed with some very serious health conditions.
Yeah.
And like I used to be the person that said that physical activity, I just don't enjoy it. It's not for me. When anyone would even like approach it, I would actually get quite prickly and just say, look, just it's not for me. Some people enjoy it, I don't. And there are many people out there that think that. And
Absolutely.
I know that that's unfortunately, it's just not the case. It's just about finding the movement that works for you. And then once you build that physical literacy, it goes beyond that. So now, like, there isn't any movement that I wouldn't want to engage with or have fun with or try with. Whenever someone goes, oh, do you want to come try this session, or do you want to come do Tai Chi? Now that I'm physically literate and more physically confident, I'm like, yeah, why not? I'll give it a go. It'll just be a good fun. While before, even thought of doing these kind of things just put me off. I didn't want to engage with them, and that's through a combination of, I wasn't confident, I was embarrassed, I
Yes.
was also a little bit scared because my memories of being active was from school and just being the worst at everything.
Hmm.
And so that shaped my view of things. And I want to try and encourage more people that have that same view to break that. Because the thing is, the only person that loses is them. They lose out because we know that not being regularly physically active has massive physical, mental, and social disadvantages that can't be recovered elsewhere. You can't do something else instead to try and get back those benefits. They can only be accessed through movement. So it's important. That's why I do it.
I love that. I love that. Thank you. And thanks for the honesty and transparency, because it's just so exciting to hear that you found it. And, you're now the ripple effects of that, that first session you went to, those first, that it's still now rippling out, much further than just your clinic and your patients. Is amazing. Exciting. Love it. Okay. So let's talk about this sort of Sport England initiative to do with medical clearance, long-term conditions, really, you've been diagnosed with a long-term condition, but medical clearance, it's tough to get. It's from a fitness professional's point of view, it's can I work with this person? Can I not? So can you talk on that? I know that you're obviously very keen to get more people moving,
Mm.
particularly with diagnosed long-term conditions. So let's hear from you on that.
Yeah, like it's a barrier because if you think about it, a lot of patients go on this journey. They go to their surgery, they've been diagnosed with, let's say, high blood pressure.
Yeah.
And one of the most important things to lower your blood pressure, if not actually, no, the most important thing is being physically active. And so often, and hopefully, the GP has told the patient that, okay, look, you need to get more physically active. And so the patient goes and takes that information. Maybe they attend a gym or they go to a class and they have a form which says, please let us know the conditions that you've got. And they put high blood pressure. And in many cases, that establishment needs, for the insurance that they've got, they need to get medical clearance to clear it. So therefore, the patient now comes back, if they haven't already given up by this point,
Yep.
comes back to the GP and they say, look, I need medical clearance in order to do my physical activity. And then the issue comes in, we are increasingly taught and practiced defensively because unfortunately there's a much greater level of litigation now. And honestly, it does debilitate a lot of what we do in primary care. Like we could often see more patients if we didn't have to write copious amounts of notes concerned about the one tiny thing that may go wrong and we get litigated. And the whole thing is, if you haven't documented it, it didn't happen. Um, so, so many clinicians won't complete the medical clearance because they just do not feel confident enough. And they go, look, what happens if something does go wrong? This is life, something may go wrong. We can't say that 100% nothing will ever go wrong for the remainder of their time. And so many clinicians just don't feel comfortable and won't do it. And so what we have is an issue here because neither side want to create these barriers, but these barriers exist. So luckily, the Faculty of Sport and Exercise Medicine, alongside Sport England, have been working to really try and get rid of this barrier. Because we had the consensus statement, which came out in 2019, stating that for the vast majority of patients, regardless of the long-term conditions, that it was safe to be physically active. And it had a small group of conditions, which it said, for these conditions, however, you've got to be very careful, mindful. You need to get clearance first. Now, that group of conditions is actually really small and doesn't include things like high blood pressure, type 2 diabetes, etc. And so what we want to do is to make it that medical clearance is only required for those, I think the list is literally 8 or 9, and very rare and very serious conditions. Like most of the time, these people aren't wanting to be active anyway. Like it's rarely actually coming up as an issue. And we want to make it so that for those with other long-term conditions, that in case, yes, we absolutely advocate it. And that doesn't mean that these patients have no risk. No, they do have risk. And the thing is, even the general population, they have risk. There's risk doing anything, even going outside, as we say, and crossing the street. But the risk benefit is far, far way towards the benefits. And in fact, those with long-term conditions, they have more to gain and far more to lose in not being active. So these can't be the people that we have barriers against, And often the term that was once used in one of the meetings that we're at discussing this is, we never talk about the risk of not being active, because that
Exactly.
risk is actually massive in comparison to the small risk of them getting active. So in fact, this Thursday, I'm going to a meeting with a whole host of different people from both the Faculty of Sport and Exercise, Sport England, Public Health, myself as the Royal College of GPs, and we're hopefully going to just crack this nut and move forward. So therefore, medical clearance just isn't required for the majority of long-term conditions. And like people know, physical activity professionals know that, yeah, we're going to start off where we meet the patient. We're not going to suddenly send someone that's come in with high blood pressure and go, yeah, fine, you're going to do high intensity spin class or something like that. No, we're going to be realistic, and the patient knows that, we know that, and we're just going to bring in a bit of common sense, which I think is always useful.
Yeah, absolutely. I'll be very excited to hear how that goes, actually. But it's great to know that the groundwork's being done on behalf of the fitness industry, because it's been a long time coming, hasn't it? Let's be honest. And there's been a lot of talk around these subjects and how do we do it. So yeah, keep us posted. So
Absolutely. And to be fair, we're not even the worst. Like some countries are far worse than us, but like we need to definitely try and be the best, because countries where they have removed these barriers, is shown to be effective. It's shown to really help engage those with long-term conditions. Like I'll use the example of, like, for example, the Paris Marathon, which I'm actually doing in April. That requires you to do a medical clearance for everyone. So like I had to get a medical clearance. This will be my 37th marathon, and they want me to get medical clearance. Do you know what I mean? Like, how many barriers, unnecessary barriers, do we need to get? When I actually went to one of my friends who was also my GP, and I was just like, yeah, I need to get medical clearance for this. He was like, what?
yes.
Like, why? So it's just an example where sometimes like risk, no matter how small or big, just gets disproportionately taken and barriers put up, which is just unnecessary.
It is unnecessary, isn't it? I get it. Historically, if I'm thinking generations, it was very much like the word of the GP is absolutely, the last and final piece. If I think of my grandparents, it would always be the GP. If they say yes, it's an absolute yes. If it's a and I love that. I love that sort of belief in GPs and stuff. But I love the fact that GPs can now start bridging closer with fitness professionals and having this collaboration to support the wider community. I mean, how exciting to be part of that. So, okay, what's on your horizon? What haven't you achieved yet that you would like to? Because you have done so much so far. What is there anything on the horizon?
There is, no, there's an awful lot. There's an awful lot. So I say two main things that I'm looking forward to this year is one, what's called the Blueprint Project. So this is a collaborative project between Sport England, Royal College, the National Academy of Social Prescribers, etc. There's quite a few other. Apologies if I haven't included you, but the list is like 10, but 10 big national organizations. And it's around how do we get primary care, so these are your GP surgeries, to embed physical activity into their core working. And what that will look like is trying to replicate what we've done here at Leamington. So this is about having group consultations with patients with long-term health conditions, talking about physical activity, giving them instructions around behavior change. It's around integrating and connecting with the local physical activity providers and giving them understanding and training about how to go about doing that.
Mhm.
And it's about how we can empower patients to take the health and, in a personalized way, take better control over it. Because I think all patients want to feel in control of it. They don't want to come in and just get an instruction or advice. They want to just be given the tools and information to do that for themselves. So that's a really exciting project where we're going to hopefully see 50 PCNs up and down the country start the process of basically replicating what we've got here. You know, the physical activity offerings we have here, that integration. And so that's going to be a big piece of work, but really exciting, really, really exciting. And so one thing I would do actually for you guys, if you want to get involved and be one of those physical activity providers for these PCNs, is like, if you just keep track of either me on LinkedIn or Instagram, once it goes live and once we have the 50 sites that we can share and say, look, these are the 50 sites that's been selected. If you are like, oh, actually, this is close to me, then yeah, reach out to these places because they're going to be really eager to start developing.
Love that. Oh, that's exciting. Okay, you said
Yeah,
there was two things.
there is too. Yeah. And so the second one is around, like, I'm developing a lifestyle medicine course that will be delivered for both healthcare professionals and physical activity providers. So if people want to get actually sound, evidence-based from scientific literature, information around lifestyle, and that will include the 6 pillars. So we're going to be talking about physical activity, nutrition, sleep, minimizing harmful substances, healthy relationships, and stress and well-being. So this is going to be a course, it's going to be a one-day intensive course that you can either attend digitally live, where I'll be delivering it, or face-to-face. And then it has like a Netflix style kind of on-demand content with further videos and articles to supplement the learning. And that was brought about because if we're going to want this blueprint to work, where we have all these extra sites connecting, we need to make sure that they are empowered with both the why they're doing it. So what's the reason behind it? The what, what's the actual science around these interventions, and the how. How do we actually do this in practice? And we're going to go through kind of exactly what's been done here at Leamington, and as well as a number of other great cases around the country where they've managed to achieve it. So yeah, so that course is going live in June. It's being delivered by Red Whale. So that's going to be really exciting just to see sort of people come through, whether they come from the physical activity sector or from healthcare, they can find something for them. And also what could be useful actually for a physical activity provider is going to a practice with a Red Well, which is the NHS is one of the biggest educators there is. That can be quite good to show, because then they go, oh, you've got a Red Well qualification.
Yeah, love that. Okay, well, you have to keep us posted. And I think what we found there is there's the third webcast. We'll be talking about that after to see how it's gone. So thank you so much. Is there anything that you haven't touched on today that you plan to, or did you have anything you wanted to say finally to the FitPro community to wrap us up?
No, my final message would be like a massive thank you for everything you do. Like, I think often people don't realize, in particular the general public, the huge health benefits that the work that you guys do up and down the country. Like, I tell my patients time and time again, like, life years and quality of life years are gained outside of this consultation room. The vast majority of the health benefits we see come from people being active, staying connected, supporting each other as a community to improve our well-being. These are the things that matter. And when it comes to the prescriptions and the surgery, yes, they are there for specific indications, but they only help a small amount. By being active, being together, being connected, they help a massive amount, and it really does. So, thank you so much for what you do. Keep at it, and keep trying to claw away at healthcare. They will listen eventually. So make sure you get to the right places at the right time.
Hussain, that's a lovely way to wrap it up. Thank you. Yes, the whole community is amazing, and also you're amazing for sharing your time with us today. So
Thank you.
look out for webcast number 3, which we'll be talking about afterwards.
Wicked.
So thank you very much for saying. They can follow you on Instagram. I am Dr. Haz. I follow him, so he's got some great stuff on there. And listen out for those links. And yeah, I say watch out for webcast number 3. Thank you very much for listening, and thanks for being part of this today, Dr. Hussain. Thanks, everybody. We've got to wave. We've got to do a cheesy wave.